What's the worst thing a doctor has ever said to you? Serious NSFW. The cancer I had has a 90% mortality rate. I ended up not having that cancer. At 30 I was rushed into hospital out of the blue with a heart infection, and needing a valve replacing. The professor was absolutely brilliant, but she told me off the record that you may want to get any close family to come and visit, and sort out any important paperwork as it's not guaranteed that you'll wake up again. I obviously pulled through, but her honesty was reassuring, and even after 10 years we still send the odd handwritten letter to each other. We also had these stupid personal televisions at each bed which cost about £2 an hour to watch. Money would seriously rack up as I was in there for weeks, but she blagged me a pirated code so that I could watch it for free lol. It was to my husband, I was in the room. I'm not going to figure out what it is. If it was serious, you'd be dead by now. Later, we found out that this doctor was the one that my husband's uncle was seeing before he was diagnosed with colon cancer. By the time another doctor found it, it was too late. He said there was no way it should have been missed. I was 18 to 19 in my first gyno appointment. I told her how something hurt when I had intimate times and I wanted to start birth control, and she told me that I was too young to have intimacy, so she wasn't going to help with that. I would constantly complain to my doctor that I couldn't breathe when I would walk and I would get shortness of breath. I was always tired and fatigued. I would get dizzy if I walked too long. She always brushed it off and told me to get more sleep or drink more water, even though I was getting plenty of both. Finally I made an appointment to talk to her face to face, and she flat out just told me I was lazy and needed to exercise more. I was so embarrassed because I went with my husband and she made me feel like I was just this lazy couch potato. I switched doctors and my new doc decided to do blood work, which is something that other ladies should have done in the first place, and found out I was severely anemic to the point of needing blood transfusions. I felt so much better after I got my infusions. Some people just shouldn't be practicing medicine. I have a real doozy for you all if I'm not too late. My sister called me in tears, saying she couldn't even stand up, she was in so much pain. I absolutely boosted to her house, find her vomiting in so much pain she can hardly move. Got her in the car, got to the hospital. They moved her into Ed pretty damn quick as she was screaming in pain. My champion of a sister managed to answer their questions whilst dealing with the worst pain of her life. She did her best to comply with their exams, etc. Eventually a doctor comes in and says they suspect she has an STD that is causing the pain. Except there's no STDs showing up on their panels. He tells us it's his best guess, tells us we can be on our way, and leaves the room. Cue my sister vomiting in excruciating pain every time she moved. We pressed the call bell and they asked what was up. I said there is absolutely no way we could leave the hospital with her in this condition. The nurse just scoffed at us, then left. We were left in Ed with my sister vomiting in pain, telling me she was going to pass. Every call button press resulted in literally no one coming to see us. If they did, we got told there are bigger emergencies than you right now. She had at least 7 buckets of sick sitting on the shelf from how much pain she was in, and no one saw us for about 2 to 3 hours, not even exaggerating. She was eventually transferred, because we became too annoying I guess, to an observation unit overnight. I had to go home cause they wouldn't let me stay. The next day, I got there, my sister was a shell of herself. She was literally gray, and said the pain was still there, she just didn't have the energy to fight it anymore. I told her since she was in hospital, at least she was safe, but she told me she legitimately thought she was going to die. A day later, she calls me, they finally did an ultrasound after 3 days, apparently NZ hospitals have no ultrasound technicians on for holiday periods, and told me her ovary was twisted around a ridiculous amount of times. She said they have to operate right freaking now. She's lucky to be alive. The hospital wouldn't allow us to have any documentation about her operation or anything. They told us it was not her information to have. The fact that doctor wrote her off as having an STD, and never looked into anything else until the last moment when she was going septic, sickens me. And the fact ovarian torsion is a medical emergency whilst we were being told there were bigger things to worry about. I'm just glad she's still here. Valp, looks like you're probably going to go blind. While I have visions of myself walking about tapping a white cane in front of me, he blithely adds, but don't worry about it. Corneal transplants are 99% effective, you'll be fine. I did have transplants later when eyesight got bad enough to warrant it. They worked a miracle, but man, lead with the you'll be fine next time. That I obviously didn't dislocate my knee. I had put it back in myself before I went to her, because it wasn't swollen out like a balloon. He then proceeded to push my knee down flat after it had seized in a bent position to put a stretchy bandage on it. I went back 2 days later because I had lost feeling in my toes as the knee had pinched nerves. They did a MRI and I had a complete tear of the ACL, and my bones in the shin bone and femur were bright white from the bone bruises/fractures. I absolutely dislocated me knee and the doctor just smashed my knee down and said off you go basically. When I was 19, my primary care doctor, male, told me he could do a pap smear for me at my physical. When I told him I already had a gynecologist, he said I can do it professionally or personally. Needless to say, I never saw him again and reported him. This was overheard by a friend of mine when a neurosurgeon looked at the CT of her son's brain. There's no point in doing this one. This kid is done. I'm out of here. The good news is another neurosurgeon did the surgery and the kid, now about 40, is perfectly fine today. Another story I heard while working in a hospital, but cannot verify. A guy was gravely injured due to being shot in the face. There was no chance of recovery and he was expected to die within a very short period of time. An intern walks in the room and says, "Is this the guy we are going to harvest the kidneys from?" The doomed patient was reported to have reacted by briefly bolting up into a sitting position. I hope it is not true, but they did get the kidneys. That I have warts, proceeded to freeze them off, and sent me on my way. I went to my family doctor and she told me I did not have warts, and was very confused by the other doctor's diagnosis and treatment. Found out later on that the original doctor who gave me TX and diagnosed me with GW had come to Canada because he lost his license while practicing in the USA. Then shortly after, his clinic was no longer open in my area. After my knee surgery, my doctor told me that I would still be able to practice my martial arts when I recovered. But I had never done martial arts before. He probably told me that because I'm Asian. In middle school, I was seeing a psychiatrist for generalized anxiety and panic disorder. I had been struggling with my weight because I was too anxious to eat, and at one point I was about 15 pounds underweight. I started taking antidepressants, and I gained weight once my anxiety started improving. One day, my psychiatrist brought me over to a scale so he could weigh me. He told me that I needed to watch what I was eating because I was starting to get fat. I was finally at the low end of a healthy weight after struggling for months, and it was such a blow to my self-esteem after all the progress I had made. I broke out in tears as soon as he said that. It crushed me. My mom yelled at him, and we walked out of his office and never came back. Said I might have cancer and then walked out the door. For 20 minutes I sat there contemplating, do I really have cancer and what will my life be now? Nurse came in and was like, "Yay, it's not cancer, just a blood clot." I was newly clean and had to have most of my teeth pulled. The dental surgeon poked around at my healed over track marks, then brought all his staff in to look at them. Then he began accusing me of taking nose candy and alprazolam the night before and threatening he would put me out because that. I literally did not understand what was happening. It was humiliating on a level I cannot explain. I was already humiliated and embarrassed at the shape of my mouth. Now this? All I could do was politely sit there and take it, wait for him to finish with all his little hate, and do his job. My doctor immediately said my symptoms were from an STD. Then doubled down saying I was lying about my sexual activity. Like, dude, I'm a grown-ass adult. If I thought I had an STD, I would have said so. I told him I thought I had a kidney infection. He said it didn't make sense. Did all the blood work, all negative for STDs. What was it? A kidney infection. Although he asked me before I left how I knew it was a kidney infection, I told him I had been watching House MD and the symptoms matched. When I was 7, I slipped and hit my head on the door axle. I was rushed to the hospital cause at that age, my skull was like butter. I was crying a lot, and one of the doctors told me stop crying or I'll make it hurt more. If the headaches and tinnitus are still present in a month, come back and see me again because it's probably a brain tumor. And with those few words my then doctor triggered a years-long battle with health anxiety. It wasn't a brain tumor, just a sinus infection. A doctor told my parents I'd gotten used to all the attention after having an emergency appendectomy and was only pretending to still be in excruciating pain. I was 7-ish. What actually happened was they'd left acid just around and it was literally burning tissue and creeping over to my liver. I spent a month in the hospital. A different doctor, who used to be a family friend, once told my sister, 6 years old, that Tourette's syndrome wasn't real and she needed to stop faking it. I can't tell you how damaging that was, and what it took to help her feel secure with her tics again. You do not seem to be in pain. If you look calm, they do not believe you are in pain, so they refuse to find out what causes the pain. You're too young to be stressed. My doctor in high school told me that. I was living in an emotionally abusive situation after being homeless. Stop being such a baby. My dentist in high school when I was uncomfortable. Couple years ago went to the doctor for headaches and stress. I run my own business. He sent off for some tests and an MRI cause of the headaches. I never have had headaches before. Told me to take a vacation and relax, that I was probably just overworking myself and stressed from my business. So took the whole family, wife, kids, dog, on a nice getaway to the Smoky Mountains and rented us a nice private cabin and had 5 whole days to relax and take in the beauty of the Smokies. Got to our cabin around 4 p.m. It was amazing. Indoor pool, billiards table, indoor putt-putt golf and an arcade room all you ourselves. I know it sounds extravagant and expensive, but we actually paid like $1,000 for the whole week. I thought it was a great deal for everything that was included. Woke up the next morning excited to check out Pigeon Forge and the kids wanted to go kart and all that. Well, 8:30 a.m. I check my email against my wife's advice and I see an email from my doctor with the results of my MRI. It read like this: Mr. Forex, the results of your MRI have been reviewed by our medical team and we have found a large brain tumor on all of the scans. Please contact us immediately to schedule more testing and to speak with a neurosurgeon. Try relaxing on vacation. After reading that I had bipolar disorder. I was medicated for it, it didn't work, so he kept increasing the dose. Eventually, I was taking 800 milligrams of Seroquel a day. I was so doped up I couldn't read. Dropped out of college. I couldn't sleep without it anymore, and when I tried I stood up for almost a week. Had to move back with my father, because I wasn't able to care for myself anymore. Tried to unalive myself a couple times. Ended up under observation. Doctor considered shock therapy. After almost 10 years lost, I had switched doctors, found a good therapist, and started the process to remove the meds. Turns out I'm not bipolar, I'm autistic. I don't have mania, I have sensorial overload and hyperfocus. I act weird when put in chaotic situations because they overwhelm me. After 2 years of therapy, neurologist and psychiatrist appointments, and hundreds of pages of diaries and reports written, I finally got a proper diagnosis and I'm free from that. I'm not getting those 10 years back though. My mom died during that time, and I'm not getting her back either. I'm in college again, but the opportunities I lost are gone forever. And the doctor? He's still out there, getting paid by the freaking drug company to push their product. Screw him. At this point, it's just the machine keeping her alive. She's already dead in the brain. After a bunch of inconclusive tests trying to figure out why my liver function had dropped like a rock, I was sent to an oncology doctor to do further testing. That doctor, looking at the previous test results, said it looked like I have hepatocellular carcinoma, liver cancer. I was floored by that. My mother had gone a few rounds with cancer and wasn't doing so well, and one of my aunts had just died from brain cancer. A few more tests and a liver biopsy later, it was declared that I do not in fact have cancer. I instead have autoimmune hepatitis. They put me on azathioprine and steroids for a few weeks and all was looking better. I was taken off the meds and it just got worse again. Did another round of treatment and got better again. This time they put me on a long-term treatment of testosterone. My levels were low as heck anyway, and azathioprine. We have tried stopping the meds 5 times and every time it just gets bad again. My immune system just hates my liver and pancreas now, and now I need to also take medication for diabetes because of the pancreas damage. I went to Yale, was his justification for promising to not do a specific thing, then walking out of my room and ordering that exact thing. I told him, I went to a well-rated community college and learned more about how to interact with people than you did. My doctor retired, then a couple years later came back to the practice and I started seeing him again. As I was laying on the exam table, he patted my gut and said, "This wasn't here last time I saw you." We spent 4-5 years TTC and I had several miscarriages. The day after one such miscarriage, that ended my longest pregnancy to date, 9 weeks, I had to go to my GP to have a thyroid panel done. The nurse came in to draw my blood, checked my chart, saw the note about the miscarriage and why I was there, and then cheerfully proceeded to tell me, "Oh honey, don't worry that this baby died. You can always just go get pregnant again." Screw you, nurse. Screw you. I complained as soon as my GP came in afterwards. My GP didn't seem surprised and blew me off a bit. I complained to the practice manager though, and I never saw that nurse again. I had cut myself and taken a bunch of pills. She said, "Either stop wasting our time and really end yourself or grow up." Thanks for watching, like and subscribe to see more content.